Today we're going to talk about the life cycle of an insurance claim from the beginning when the patient comes to the office and checks in all the way through when they receive the EOB or explanation of benefits or any bill with any remaining patient responsibility. First, when a patient arrives, as you can see here, at the top, we will see patient pre-registration and established patient financial responsibility. And then next will be the patient check-in and patient check-out at the doctor's office. And then it'll go to what's called the super bill, which is the encounter, also known as the data for. So this is when all the services are rendered for that date of service, that initial encounter, however long that may last. And then we go to prepare and transmit into claim at the bottom. And that's when the claim is provided to the billing office and they do their due diligence to get it sent over to paid. And then next is a monitor payer adjudication. And that is when the bill is sent to the clearinghouse or well, the bill is already in the clearinghouse at that point, or to the third party payer. And the billing office is just simply monitoring it to see if it's being accepted, denied, rejected, or what have you. And then next is the patient statement. That's when the patient receives any bill with outstanding balance for patient responsibility and their EOB, their explanation of benefits. And in the middle is what we all want to get to, which is the paid, not patient collections. But if the bill does go unpaid, then there'll be other steps that will come into play that we'll get to. Now, this is patient pre-registration. And also I added in that to establish patient financial responsibility. Now, what is pre-registration? Okay, that typically occurs when we call to make the appointment with said doctor or provider, whether it be the hospital or what have you. This is when all the necessary information for patient records is provided over the phone, such as proof of insurance, which is when the insurance information is provided to the medical assistant or whoever answers the phone for registration. And then, excuse me, and then proof of patient, excuse me, identification. That is typically done when the patient goes into the doctor's office or arrives for their hospital admittance. They will show their ID or passport. So state ID, driver's license, passport, and then they will also bring in their insurance cards. And then reason for appointments. So, of course, on the phone when you're calling in, you'll say why you're calling and all of that. And that all will be documented on that call. Intake forms are completed to gather patient health history. So typically, we all might be familiar with MyChart. In recent years, this process can be done online through an app called MyChart, or maybe that facility has their own online registration. If that is so, then documentation such as your ID, insurance, all that can be uploaded online into your medical records from there, as well as sometimes even intake forms can be completed online as well. Now, who is financially responsible? Well, this is dependent upon the reason for the appointment and insurance policy holder. So possible parties are the employer, if it is a job related injury or illness. So for example, workers' comp, if you get injured on the job, many times when you go in for an appointment, or if you call, they'll ask, was this a job related injury or therapy or whatever the appointment is for? Then the employer is responsible for that claim once it goes through its due diligence of processing, and that's a approved claim. Patient self. Um, no insurance is considered self-pay. And so that is called self-pay. So then that would be the patient who is coming in. If they do not have coverage, then they're considered self-pay, meaning that they're going to receive a bill, and it is exactly what it says. All the information will be provided on that bill, what happened, and the amount that they owe. Policyholder. So whoever carries the insurance, including the patient. So the patient could be the policyholder, or it could be their spouse, or it could be their grandchild, or it could be, their significant other, domestic partner, son, daughter, what have you. So whoever was the one who signed up for that insurance, and is paying that coverage or having the premiums deducted from their pay if it's a private insurance. Now, patient check-in and check-out. What happens at check-in? Well, upon arrival, the patient checks in at the front desk. The nurses are advised of their arrival as well. So typically when the front desk patient services representative checks them in through the system, the computer also is updated in the back. So the nurses know, the medical assistant knows, so they know who, if, 12 o'clock appointment is here for Dr. Smith, for example, they can go out and retrieve, said patient for Dr. Smith. What happens at check-in? Well, we already briefly covered this in our previous slide, but the patient provides their ID, insurance cards, and typically they're scanned into the system from the patient service representative, the front and back, for billing purposes, and provided back to them. The ID, they also verify the patient's demographics, so their address, their phone number, emergency contacts, all of that is verified. If applicable, I know like during COVID, many times you're going to be asked, have you traveled outside the state or the United States within the last 30, 60 days or what have you? Have you been around anybody with COVID? So it says, if applicable, current travel and contagions are provided to the front desk. I mean, they want to know, hey, if you were during COVID times, I know if I took my son to the appointment, if I was like, yeah, he tested positive for COVID before we came, or his sister has COVID, they're probably going to say, okay, and put you in a room right away to help keep any contagious germs from going around the office, infecting other patients who may be more vulnerable. And intake forms are assigned, and copy of HIPAA patient rights are provided. So if there's any intake forms that need to be signed, they're done at that time as well. Many times they'll ask you or provide you a copy of your rights, your HIPAA rights as well. Copays are collected. So if your insurance requires a copay, then the copay is collected at that time. And patient demographics are verified. So we already kind of touched on that. What happens at checkout? Well, just what it says. Upon completion of the appointment, the patient will check out at the front desk. Any end of appointment tasks will be done, including but not limited to any follow-up appointments will be scheduled for the patient and or other family members. So if at the end of their appointment, the doctor's like, hey, I want you to come back in 10 days after you complete that bout of antibiotics or, recheck, whatever it may be. Many times the patient will take care of that before they leave. or if anybody else in their family. Sometimes, if you're me, you forget all the time until you're there that, oh, your daughter has to see the doctor as well. Well, I'm here, let me take care of that. Any additional forms or documents are exchanged. So if there were forms given to the patient had to be completed prior to leaving, or if they had to give it to the doctor and they forgot to do so, or what have you, that can be given to the front desk. Or if the front desk has any documents for the patient, like school notice or a work note or something like that to that effect. Any additional forms or, oh, nope, sorry, we covered that. Last or next steps provided pertinent to patient care. So if the doctor says you need to go to lab, or you need to go down to x-ray, many times the front desk will guide them and show them where to go, or if it's they have to go get a urine test, for example, or something like that, and it's in a different building, different floor, what have you, that will be identified with them and discussed with them. And then, of course, have a good day and see you next time. So, yeah. And this is a super bill, the encounters. So, the super bill is exactly that. It is comprised of everything that happened on that encounter and that encounter. So, if we read this, it says a super bill is an itemized list of all the patient services rendered for that initial encounter. Although this information is typically provided to the third-party payer on the patient's behalf, this document can also be provided to the insurance directly from the patient as well, which is more commonly done in an out-of-network situation for patient reimbursement. In addition, to the patient information, the super bill includes the CPT and ICD-10 CM codes, date of service, physician's name, signature, and contact information. So this is everything that happened at that day. This is going to include, most importantly, first of all, the name. Who is this for? All the patient's information, the date of service, and when so after this is done and everything is included, like the CBT codes and all of that, and the physician signs and all his or her contact information is included, then that is sent on for further processing. Sometimes if it's an out-of-network provider, many times you'll see is with dental. If somebody or vision, somebody goes to an office and they say, hey, we don't bill for this carrier, or your carrier is not covered or something like that. They'll say we can provide you the super bill. They wouldn't call it super bill though, but we can provide you the bill, the list of services, and then you can submit that to your provider on your own for your patient reimbursement. So if you had to pay out of pocket and this is something that is covered through your carrier, then you can also send this in with any necessary documentation to support it as well for reimbursement. Next is to prepare and transmit the claim. Yes, we're almost there. The hospital or healthcare professional provides a claim which is examined for accuracy, then submitted by the coder to a clearinghouse for processing of the insurance company. The claim must include all of the following. It must include the patient's name, patient's medical record number, used on the UBI 1450 form, patient's account number, patient's demographic information, subscriber information, which is the insured member of the policyholder, like we discussed before. So if the subscriber is the patient's husband or wife, then their name would be on it as well. Subscriber number. So if you look at your insurance card, your number, the group or plan number, all that information will be on there, which is the reason why the front desk makes a copy of the front and back. Any secondary insurance information, if applicable. So if you have insurance and your child has insurance, or you have state insurance and you have private insurance, both insurances would need to be provided so it can be submitted, and they would pay a coordination of benefits called COB, which is something that we'll learn later on. Prior authorization referral number, if you were referred to this specialist or provider or something like that, that would be sent in. Or many times the PA, the prior authorization, is acquired on the back end. Many times the patient has nothing to do with that. That's a number that's provided from the insurance company saying, hey, we approve this claim and it will be paid. So this is your prior authorization. We are authorizing the service prior to you submitting the claim. Rendering service provider's name. So that is the provider who provided the services that day. Rendering service provider national provider identification number, the NPI. So every provider in the US has their own national provider identification number for them. And it's just like pharmacists do. And pharmacists also have what's called DEA number, which is also for so they could prescribe different types of I think it's called class 4 medications like hydrocodone and things of that nature. Date of service, diagnosis codes, procedure codes, revenue code used on the UB 1450 form, itemized charges for services rendered. So everything itemized. So just like if you're doing your taxes, your itemized deductions or an itemized statement. So you'll have, maybe you'll have your appointment was for a preventative care, follow-up appointment. Well, then what happened at that appointment? A, B, C, and D, like your initial bullet points. Number of service units for service provided as well. So once all this information is reviewed and examined by the coder for accuracy, then they'll either submit this to what's called a clearinghouse, or they'll submit it directly to the third-party payer, whatever their process is for that office. All right, this is the monitor payer adjudication. This is when the claim is evaluated to determine validity for payment or coverage. I mean, sometimes it could be covered, but there may not be payment submitted by the insurance company if there was a out of pocket still needed to be covered from the patient. So just because something is covered or approved does not mean it will be paid in full or even paid at all, depending on the policy. So this is when the claim is followed through the system by the billing office, the coder. So it'll either come back one of three ways. Accepted. If it's accepted, the claim has been verified valid and will be paid according to the insurance policy, less out-of-pocket patient responsibility. So if they had a maximum out-of-pocket that they still haven't met for an individual or family, if they had a deductible that wasn't met, something like that. So say, for example, they had a deductible still for $50 and their bill came to $150. Well, the insurance company is not going to pay the whole 150 because that 50 still has to be covered by the patient. So they'll pay the $100. Rejected. If errors have been identified or omitted or omitted pertinent information, claim can be corrected and resubmitted. So if there were errors like incorrect coding or something like that, or maybe it was missing the patient's address, or maybe the patient's name is a mismatch in the system, everything has to be exact how it is for the patient and for the claim to be paid. Then once that is corrected, the billing team can resubmit that for acceptance. Denied. payer denied claim typically due to either inactive coverage or coverage doesn't include the services rendered. If coverage is active, patient or provider may have the option to submit an appeal for reconsideration. So exactly what it says. I mean, if it's denied, either it's typically not denied for one of two reasons, right? So it's either denied because maybe their coverage lapsed. Maybe they no longer had this coverage and they thought they did. Um, or maybe they do have insurance, but maybe this particular procedure or code is not covered. And that is something that has to be reviewed. Many times, if the provider's office may say, "Oh, no, 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 this is um, per our contracts, this is a service or coding that is covered," then they have to provide that supporting information and resubmit it they would appeal and resubmit the information for reconsideration. Or even the patient sometimes has to do that. If they're like, "No, I was told this was going to be covered. This says I have this coverage." Well, then they also, if applicable, can also file an appeal and provide all that supporting documentation. Typically, an appeal can take up to 90 days, sometimes longer, depending on turnaround time, right? Depending on all the accuracy of information, the supporting documentation that's requested and submitted, and so on and so forth. So that's a whole different process. Patient statements. So this is once everything is processed, the patient receives an EOB and a bill if applicable. So EOB, we briefly mentioned in the beginning of the call. This is sometimes typically something that patients will see. Many people think it's a bill when they open it, although it does say at the top, "This is not a bill." But even I sometimes um it goes right past you. You see all these, charges. You're like, what is this? So the explanation of benefits is a document sent to the provider and patient outlining all services rendered for each data service. You also will see that as DOS and fees associated. And if there was insurance remittance, this will be listed as well. And then shortly after the EOB is received, a statement will be sent out to the patient if there's any outstanding balance or patient responsibility once all the payments have been processed by any third party. Okay, and we are at the end. So hopefully we're on the left side where the it's paid, right? So once the bill is deemed valid by the patient and whatever questions they have, typically that's when they are gonna call and, find out, is this, and that. Once they feel like all of that is accurate, they're gonna go ahead and make a payment, and clear any outstanding balance they have. Or it'll go to collections. If it's so, let's read what it says. If a statement is unpaid, the patient will receive calls from the provider's billing office. Typically, after 90 days, a third-party billing team will acquire the debt, and per the FDCPA guidelines, they'll make attempts to resolve a balance via negotiations, negotiating the balance. Many times that's an option. If there is a dispute, balance in full. They'll first, of course, many times ask for the balance in full, or by any other means within their scope. So if they were given authorization to have the patient allow the patient to make monthly payments, they can do that. So the whole point of that is to resolve the matter one way or the other. Either it's disputed, or that maybe the patient's refusing to pay it outright for whatever reason they may have, or they're going to make payments on it. Some type of resolution is what this next team will be seeking. And then that is pretty much the end. That is pretty much the end of where we're going to be at now. So, yeah. If you have any further questions, please send it to my email. And Everyone have a great day and go to lunch. Bye bye.